Good evening, doctors. My name is Ankur Gautam, and again I welcome you all to yet another episode of Diabetes Essentials Season 3 with Dr. Sanjay Kalra. As July to October months are tropical fever months and with the high OPD months, with that in mind that we have started 6 week series on topical fevers, we have already completed three lectures named acute tropical fever, nursing and home care in fever, tropical fever with rashes, and fourth chapter that we are going to do today, that rational use of diagnostic in fever. For this, that we have our host, Dr. Sanjay Kalra. But before moving forward, I would like to announce the last week quiz winners: Dr. Shantanu Kumar Bhattacharya from Kolkata, Dr. Kaval Saluja from Mumbai, Dr. Surjit Kalsi from Noida, Dr. Sanjeev Puri from Hoshiarpur, Dr. Rajiv Handa from Delhi, Dr. Bharat Praveen Mitta Kota from Surat, Dr. Farid Khimani from Mumbai, Dr. Sanjay Shiroha from Surat, Dr. Girish Jesota from Mumbai, Dr. Shashi Khare from Bhopal, Dr. Praveen Hundiwale from Dombivli, Dr. Pradeep Pathade from Vashi, Dr. S.M. Hussain from Delhi, Dr. Ravi Bharat from Sirsi, Dr. Pradeep Patro from Chhatrapur, Odisha, Dr. Javed Ahmed from Lucknow, UP, Dr. Shashikant Shende from Mumbai, Dr. Ashwani Kumar from Kanpur, Dr. Ramesh Hegde from Bangalore, and Dr. Anand Purande from Mumbai. So thank you, doctors, to take part in our quiz. Now, I would like to welcome our host, Dr. Sanjay Kalra, President, South Asian Federation of Endocrine Society. Over to you, sir.
Thank you, Ankur, and a good evening to everyone who is logged in today. We meet each other every Sunday evening, and I look forward to these events where we are able to connect with friends from across the country and beyond. For the past 3 weeks, and this is the fourth week now running, we've been talking about tropical fevers. And it's a matter of great pride and pleasure for me to welcome an old friend, someone who we've already met on Diabetes Essentials, Dr. Abhijit Kumar. Dr. Abhijit is physician and medical superintendent at the regional hospital in Bhuli, Dhanbad, in eastern India, and he'll be speaking to us today about managing tropical fever. Now, Dr. Abhijit brings with him a lot of expertise, a lot of experience, and of course, eminence. He is very well known in eastern India, and he'll be basing his talk on evidence, the latest cutting edge technology, drugs that we can use to manage tropical fever. So, a warm welcome, Dr. Abhijit, and we look forward to learning from you what is the rational way, a cost effective way to managing the various tropical fevers that we all encounter in our practice. Thanks to everyone, and we look forward to listening to Dr. Abhijit and learning from him.
I think we are facing some problem in terms of joining Dr. Abhijit. He's trying to join, but meanwhile, I was very happy to see the names of lots of doctors who are participating with us on this ongoing journey with tropical fevers in India, especially in our series where we are basically known for taking care of diabetes essential every evening. However, we thought basically that most of the time we miss out many things this season in India. A lot of tropical fever has been reported, especially in western part. We have been reporting, even in Bombay now we have reported Zika virus and leptospirosis in many in number. And in North India, we are listening that every day there are a lot of increasing cases of dengue. So in last three lectures where we had Dr. Sunit Verma coming and especially taking a lot of questions of doctors who are facing day in day out challenges with treating patients of dengue. So I think our journey has really given us a chance that myths have been broken. Platelet going down, hematocrit, what needs to be done, blood pressure, everything that has been taken care by Sunit Verma. Then came Dr. Kalra, and he has taken the session of uh, nursing and home care. And now last session we have been taken has been taken by Dr. Paritos. He will be once again joining us maybe in coming weeks to take care of the question and answer series. So we have made sure that we get the question and answer being answered by really those doctors who are being treating the patient first hand. That's the experience we have bring in our diabetes essential. Uh, we are also reaching to World Diabetes Day, where we usually bring in a foreign delegate. Last time we brought in, last three times I remember, Dr. Julio Rosentek has come in and he has given excellent lecture on SGLT1 inhibitors and GLP1 analogs. Then we also had Dr. Om Ganda coming twice in our uh, session, where he has brought in this because he is a master in lipidology in the world, so he brings in his expertise of what's happening in the world of lipidology. This year also we are looking forward to get him on board. And one more Indian origin doctor who is in one of the board of directors of ADA, American Diabetic Association. He is also there with us. Last time he was there with us. He's basically ex AFMC Pune graduate. So with I think this is the platform where we have got lots of expertise, and then obviously we have Dr. Sanjay Kalra on top. He brings in every day uh, knowledge which is getting updated on diabetes essential, and he makes these topics very interacting, and he makes sure that everyone who's attending the session, whatever questions is being posted to him, have been taken care by him. So then let me check whether Dr. Abhijit has joined. I've been informed that he is joining in a minute. I think this is probably some technical issues he is facing in his uh, joining procedure usually. Yeah, we can't see him in backend. That's what we can learn it right now. So anyway, I continue. So next three sessions also, because we are in this tropical fever journey. So then we have uh, today we will be discussing about the diagnostics. This was the topic which we have decided because there are a lot of diagnosis tests have been made uh, by the doctor. So we thought which are the essential tests. So now we have Dr. Abhijit with us. Without wasting any minute with us, I hand over this topic to Dr. Abhijit. Sir, today's topic, please take it off.
Okay. Good evening, everyone, all the seniors and colleagues. I'm very sorry for the delay for 5 minutes. It was a technical fault. Okay. So the topic for today is diagnostic tests in fever, rational diagnostic tests in fever. So India, the basic idea to deal is tropical fevers. As such, tropical fever itself, it is not any disease. Tropical fever, the term we have coined, and the topic we have coined for the educational purpose for our own understanding, and to broaden the treatment line, to broaden the treatment line. Yeah. May I have the slides also side by side? Yeah, thank you. Yes. So first thing is that Tropic of Cancer passes through 8 states of India. That is starting from the eastern India, Gujarat, western India, Gujarat, then Rajasthan, then MP, Madhya Pradesh, then Chhattisgarh, then Jharkhand, then West Bengal, and then Tripura and Mizoram. So tropical fever and subtropical fever, due to the weather condition and due to the rainy season, certain bacteria, certain parasites, they are born to cause seasonal fevers, and we must be very curious, and we must be very investigative approach should be there to treat such type of fevers. Now, as I would like to highlight that what is the main concern for the tropical fever? Why we are focusing so much on its diagnosis? So the main concern is high prevalence is there, and morbidity and mortality is there. As such, many media reports is there, as we can see the situation in Delhi sometimes few years ago. All the hospitals were flooded with the patients. There were very less number of beds available, and we have seen certain episodes like where parents committing suicide in case of death of their child. So such type of incidences sickens the entire country, and as a doctor we must be very vigilant to diagnose it and treat it. Now, what are the difficulties in this is that there is overlapping clinical presentations, and there is difficulties in a specific diagnosis, and there is need for early empiric treatment. Now, next page, please. In this. Now, there are few, I want to highlight few of the diseases which you have seen in the earlier slides, like dengue, rickettsia, scrub typhus, malaria, typhoid, leptospira, and certain viral infections. Now, what is the key idea for tropical fever is syndromic approach. So when we go by the syndromic approach, it helps us to ease our diagnosis and to limit the number of tests which is required. So there are 5 major clinical syndromes. First one is undifferentiated fever. Second one is fever with rash or thrombocytopenia. Third one is fever with ARDS, that is acute respiratory distress syndrome. Fourth one is fever with encephalopathy, and fifth one is fever with multi-organ dysfunction syndrome. Now, as you can see, certain signs and classification also side by side, sign and classification of fever has been highlighted in the slides. Like for malaria, malaria kit test is there to diagnose it or not. Okay, next page, please. Yeah. Now, what is the key idea in tropical fever? The key idea is to hit wide and hit early. Hit wide because we have to cover a lot of disease at simultaneously at the same time. Hit wide and hit early for early diagnosis so that we can specify our treatment. Now, what is the approach? So approach is same. It is the gold standard approach for any disease, that is to secure ABC, that is airway, breathing, and circulation. Now, what are the certain tests I am highlighting? Rapid diagnostic test at admission, what is required? Like malaria card test, then malaria peripheral smear test, both thick and thin smear, then dengue card test, then Tiffy dot or PCR for certain viral test, polymerase chain reaction. Now, depending on the diagnosis, we would be starting our treatment. Like the key idea is to start with the empirical treatment till the diagnosis has not been made. When diagnosis has been made, then we start the specific treatment. Now, next page, please. The diagnostic approach, as you can see, a lot number of tests and testing ESR, CRP, tuberculin skin test, etc. Peripheral smear is there. Yes. The main focus arises fever with encephalopathy. In case of encephalopathy, there is raised intracranial pressure and chances of mortality is very high. So we have to diagnose it early. We have to specify our treatment. We have to stabilize the patient. And in this, our key idea is to reduce the intracranial pressure. And simultaneously, the investigation comes CT scan and MRI. We have to add it. Next page, please. Yeah, next page. Now, there is certain types of tropical fever which are more serious. We need to focus on presumptive therapy as well. Like without waiting for the investigation and diagnostic, we must, if we are clinically suspecting, then we could start with the injection like ceftriaxone, and we could combine it with the antiviral treatment also, like injection acyclovir in case of fever with encephalopathy. There are different type of instruments used in diagnosing fever, as you can see in the slides, like digital sublingual thermometer, digital rectal thermometer, infrared temporal artery thermometer, and various others. Okay, next page, please. Yeah, in case of diagnosis of fever of unknown origin, FUO becomes the core in case of treating a patient, because what happens that when we start treating our patients in hospital setting, apart from patient, their attendants also gets very curious to know what disease actually the patient is suffering from and whether our treatment is specific or not. So in case of FUO, we have a standard approach, as you all can see in the chart, like different modalities of investigation we will be doing, and we will be just analyzing what sort of disease the patient must be suffering from. It is very clear from the chart, and it is very easy to go by the systematic approach as shown in chart. Yeah, next page, please. Yes. Now, diagnostic imaging in patients with fever of unknown origin. Now, here lies the key aspect, like chest radiograph, CT scan, MRI, PET scan, and for tuberculosis, certain specific test is there, like tuberculin skin test to detect latent infection, and for diagnosing also a specific culture is there, TB gold, CB0, etc. PET scan comes a boon for the patients as it suspects malignancy very early. And in case of fever with unknown origin, a possibility is there that patient might be suffering from malignancy or cancer, and PET scans is a boon that early diagnosis will help in saving the life of patient and to increase the prognosis of the disease. Yeah, next page. As you all can see, certain quiz questions is there. Before going through the quiz questions, I would like to highlight certain key diseases and what is the approach in their diagnosis and what is the treatment aspect which we will be highlighting. Like for example, scrub typhus. Scrub typhus is caused by the organism Orientia susugamushi. The vector here is chiggers, that is larva of trombiculid mite. And what is important of scrub typhus, that it is likely to go for MODS, that is multi-organ dysfunction syndrome. It infects the vascular endothelium, and which in later stages involves multiple organs like liver, kidney, meninges, brain. The clinical feature is fever, headache, myalgia, and SCHAR is common in this scrub typhus. So we must be very focused for the scrub typhus. The treatment is tablet doxycycline 100 mg BD for 7 days, and in case of pregnant women, we can switch over to safer alternative like azithromycin or chloramphenicol. Now, another disease is leptospirosis. The causative organism is Leptospira interrogens. The source of infection is direct contact of skin or mucosa with water contaminated with urine or body fluid of infected animal. And here also the pathophysiology is that leptospires multiply in a small blood vessel endothelium, and the diagnosis lies with the raised CPK level is there, creatine phosphokinase, but it is not very much a specific diagnosis. So we go for microscopic agglutination test, and ELISA is also recommended to look for the IgM. Now the treatment is penicillin G, 1.5 million international unit. It is 6 hourly for 7 days. Alternatively, we can go for the third generation cephalosporins like injection ceftriaxone. And in case of very complicated cases, we can also go for plasma exchange or corticosteroids or intravenous immunoglobulins. Certain more key diseases which comes in this category is dengue. In case of dengue also, we have to go by the clinical features like dengue fever, dengue hemorrhagic fever, dengue shock syndrome, or expanded dengue syndrome. And then comes malaria, which is most common in entire means South Asia countries, including Sri Lanka also. And the causative organism in this is Plasmodium, which is a protozoa, and 3 species are common in India, Falciparum and Vibex, and malaria is also common in particularly to Odisha. Now, in case of malaria also, there is a classification of treating, like if it is a severe malaria, cerebral malaria, or it is associated with acute renal failure, ARDS, shock, DIC, etc. The diagnosis lies with the thick smear, thin smear, and then we have the rapid diagnostic test also, which is done through the kit. Drug of choice is artesunate. It could be combined with doxycycline also. Alternative therapy, we can add on quinine. And then we have few more diseases like enteric fever, and Japanese encephalitis, and tuberculosis also. In case of tuberculosis, our focus is on sputum examination, chest X-ray, and now there are very much better options available, like TB Gold is there and CB NAT is there. So this much is from my side. Thank you.
Quiz also, sir. I think Faraz, can you have the quiz on the screen? Yeah. So the first question of the day is, which approach best reflects the rational use of managing evaluating fever for unknown origin, FUO? Option A, ordering multiple imaging tests regardless of clinical presentation, or B, ordering imaging tests solely based on patient subjective complaints. Option C, employing imaging studies based on clinical suspicion and risk factors. And option D, avoiding imaging studies altogether to reduce healthcare cost. Second question, please. Fever and respiratory symptoms, which tests should be considered to diagnose tuberculosis? A, CBC, B, blood glucose, skin test, TST, and D, sputum culture for acid fast bacilli. I think with this we end the today's session. I can see a lot of questions coming from the diabetes. So today sir is not able to join. Next week all those questions will be once again be reflected to Dr. Sanjay Kalra. He will be taking all the questions. With this, I sincerely thank Dr. Abhijit Kumar for taking his time and giving us a simple framework for managing the essential tropical fevers which is commonly seen in the OPD. At the same time, the treatment as well as the diagnostics which can be used to differentiate amongst all the tropical fever. Thank you, sir, and look forward to be with us in coming journey with diabetes and sir. Good night, sir, and Jai Hind.
Thank you, sir. Jai Hind. Thank you so much.